Hello everyone, we're going to do Chapter 10, Part 3 today, Legally Required Benefits. I'd like to start with some things I was reading about yesterday. And these small business owners, remember that's less than 500 employees, have some really difficult decisions to make. So on the one hand, they can take out a Paycheck Protection Program loan, okay? But that loan can actually convert to a grant, meaning the government just gives them that money as long as they use at least 75% of those funds to maintain payroll to those pre-pandemic levels for at least 8 weeks. So this is the paycheck protection part of it. Okay, but if they're unable to do that, then it stays a loan and they have to pay that money back. On the other hand, instead of taking out a loan, they can actually lay off those employees, and then those employees can collect unemployment benefits. That would be the state benefit plus the additional $600 that they're going to get from the federal government. So the article that I was reading said that perhaps taking out that loan would be better suited for those firms where the employees have higher wages and they can work from home, because we know that that business is going to continue to generate revenue. That business is going to keep going. Whereas it may not be a good idea to take out a loan for businesses like retail, hospitality, where we just don't know when they're going to be able to return to operations. And if you're not generating revenue, it's really difficult to keep paying employees. And if it's going to last longer than 8 weeks, there's the rub, right? Also, there are some workers who have said that they'd rather stay on unemployment, right? They'd rather be laid off. So then another question comes up. Is it legal? What happens if workers just don't feel comfortable leaving the house in the pandemic? Let's say the employer actually has a job for them to do, is willing to pay them. So if that's the case, can they then go collect unemployment? Now, if they do want to stay home, most reasonable employers are going to say, that's fine, I just may not have work for you in the future, and I can't guarantee that. But the question of legality comes up with, can employees actually refuse work? Do employers have to challenge that employee's unemployment claim? Could it be considered fraud? Because typically in non-pandemic times, it is illegal for somebody to collect unemployment if there is a suitable offer that they are refusing. So they just choose not to work. Okay. So as usual, just interesting questions. I don't have the answers, but I think we'll see how this plays out. All right, so let's get into the chapter. We're going to talk about the Family Medical Leave Act, and you've probably seen this in your Management 582, and maybe if you've had 466. And the purpose of the Family and Medical Leave Act is really we're just trying to protect people's jobs in case of family emergency or own personal medical issues. And it guarantees that somebody will have a job, and it's either the exact same job or a very similar job when they return to work. So what are those benefits? The benefits, first of all, are 12 weeks of unpaid leave, and that can be all at one time or it can be intermittent throughout the year, but it's 12 weeks within a year. And the employee maintains any seniority that they have built up or other forms of employment benefits. They're not accruing anything while they're off, but they don't lose anything either. And they're also going to maintain their health insurance coverage. Okay, so when you go to file for Family and Medical Leave Act, it's a process. This is a very administratively heavy process. So first of all, you've got to request it, and then HR has to determine if you're actually eligible for it, and then you have to have lots of medical documentation that's going to support your claim. Then HR says, yes, you can, and here's how your leave is going to go. If it is continuous leave, you've got to make sure that you stay in contact with HR and your supervisor. If it's intermittent leave, then if, say you've got a chronic disease and so there are things that are happening throughout the year that require medical attention, then you got to make sure again that you have lots of communication with HR, with your boss, regular procedures. You want to try to schedule those in advance if you can. Then the employee's got to make sure you're recording the absences accurately on your time and attendance sheet. And then before you can even come back to work, you've got to get a medical release. You can't just decide that you want to come back to work. The doctors have to actually say that you are medically fit to go back to work. And then we need those at least 24 hours before reporting back in. So the CARES Act, that is part of this pandemic, one of the things that it has on there is this paid leave. And so just wanted to share with you guys that as part of that Families First Coronavirus Response Act, you had the paid leave that we've talked about already, that 2 weeks of paid sick leave at your regular rate of pay if it's yourself and you're in quarantine or you are experiencing some symptoms, or 2 weeks of paid sick leave at 2/3 your regular pay if you're taking care of somebody else. But in terms of the Family Medical Leave Act, you're also going to get an additional 10 weeks of paid expanded family and medical leave at 2/3 your regular pay to care for those, your children who are out of school, okay? So the next part is employer-sponsored health insurance. So it has been expanded during this pandemic to cover diagnostic testing, and it also affects some of the health savings accounts, which we'll get into later. So let's just set the stage here for these employer-sponsored health insurance. Okay, so here you can see that 56 of the United States population, and this was in 2017, so it's a little bit dated, but they have that employer-sponsored health insurance. 62% of those under the age of 65, which makes sense because those over the age of 65 will use Medicare. Now, 87% of workers consider healthcare extremely important benefit, and I'm surprised it's not higher than that. But even still, even with employer-sponsored healthcare, look at how expensive it is for the individual. So $7,000 plus is the average annual premium that each individual pays. But if you are a family, it's $20,000 plus a year for the premiums that the employee is paying. So with these expanded benefits, there are estimates that employers' healthcare costs could rise in the coming year 7%. And again, it's going to depend on the infection rate, but 7% is a really large increase in health insurance, which is already really expensive. And then we're going to talk about self-insured versus fully funded. So self-insured or self-funded group health plans say that the employer is paying themselves. So they put money away in a savings account. We'll say it's not really a savings account, but they earmark certain money into a trust fund for any health expenses. And then they just pay the claims as they come in instead of paying an insurance company. Now, what happens is that that employer then assumes all the risk associated with paying employees' health care claim. And now, with these expanded coverage, the cost of claims in a year could potentially be far higher than premium contributions paid by employees. That could be a problem for these organizations because they're still financially obligated, obviously, to pay these things. The fully insured plans, on the other hand, right, they pay to an insurer like Blue Cross and Blue Shield, and then those health providers pay the costs to the hospitals. So I think that's all I want to talk about today, and then I'm going to get into the Patient Protection and Affordable Care Act. It's a very big topic, so I'm going to set it aside.